Hi, everyone. Welcome. Good afternoon. It's great to see you. Thank you for joining us for today's forum. I'm Marlena Holden, Chief of Staff for Student Health and Wellbeing, and I have the privilege of working to support students in our campus community. The three people joining us in conversation today have spent the past 2 years working on COVID-19 policies, have answered hundreds, if not more, questions, supported academic staff, provided patient care, and guided us in keeping campus healthy and safe. In the next hour, we're going to answer as many questions as possible that have been submitted to go.wisc.edu/S22 questions. That link is below. To date, we've had more than 30 questions submitted, and you can still send in questions during the next hour, and we'll be answering them live. As we get started, I would like to thank our partners at McBurney Disability for captioning today. You can find links below in the event description for those services. Let's go ahead and introduce our panelists because, again, we want to get through as many questions today as possible. Please welcome Dr. Carol Griggs, Associate Executive Director and Director of Operations at University Health Services. Dr. Griggs has been instrumental in setting up the testing and vaccine operations for campus. We also have Dr. Nasia Safdar, Associate Dean of Clinical Trials, a professor of medicine at UW School of Medicine and Public Health, and a medical provider. Dr. Safdar is on the front lines of managing the pandemic in a hospital setting and supports campus by reviewing policies and plans. And we also have Dr. John Zumbrunnen, Vice Provost for Teaching and Learning and a professor of political science. Dr. Zumbrunnen has worked closely with academic staff on supporting the teaching and learning parts of campus and supporting the thousands of instructional staff along with the tens of thousands of students on campus. Thanks again to our panelists, and I'm looking forward to our conversation. As we get started, I also want to remind people that UHS is offering no-cost COVID-19 vaccines and boosters at the main UHS clinic located at 333 East Campus Mall. This is for all UW-Madison staff and students. You can find out more information about that at covidresponse.wisc.edu. Let's dive into questions and get started. Again, questions have been submitted in advance, and we're taking live questions as they come in. The goal of this forum is to answer as many questions as possible, and you can submit questions at go.wisc.edu/S22 questions. I'm going to start off with a series of questions that came in from our COVID Student Advisory Board. This is a group of 8 appointed students that have met since the fall of 2020. So the first question is for Dr. Safdar. Dr. Safdar, what do we anticipate will happen after spring break? And do we think we will see a surge of COVID-19?
Of course, one of the things that this pandemic has taught us that we can never really be great at predicting when something has not been seen before. But based on what we've seen thus far, I think bad as everything was with Omicron, what it allowed us to do was to generate in the population a great deal of immunity, whether from vaccination or from natural disease. And so given the way the case counts are now and the transmission, I would be surprised if there was a surge. There probably will be an uptick in cases transiently, which is what always happens when people get together. But I do not think that it will reach the level of any type of surge like we've seen before.
Thank you, Dr. Safdar. The next question, I think Dr. Griggs can answer. And again, the first series of questions that we're answering were submitted from the COVID Student Advisory Board, a group of 8 appointed students that have been meeting since the fall of 2020. So Dr. Griggs, can you please talk about what other Big Ten institutions are doing on their mask mandates and how similar or dissimilar those mandates are to UW-Madison?
Yeah, of course. So when we look across the Big Ten, what we're seeing is that folks are starting to do the exact same thing that we've already done, and one of the things that we continue to do, and that's really look at their local public health metrics, and so what is happening in their county. When it comes to mask mandates, as you know, this has always been kind of governed by what the CDC has recommended based on transmission that's happening within a local area. And so here in Dane County, we actually are in the low category. And with that, masks are actually not recommended in indoor spaces, although there could be recommendations for folks that have underlying health conditions and such. And so what we're seeing across the Big Ten, which is also happening across a lot of institutions, is that folks are having those discussions with their local health departments to really make the best decision for their particular location.
Thank you, Dr. Griggs. Another question for Dr. Safdar, and then we have a whole section coming up about masks. A number of the questions submitted were about masks. Dr. Safdar, this question again from that COVID Student Advisory Board. How are our measures for COVID spread in the community or on campus changing? And could you also please speak to what numbers you specifically look at and track?
Certainly. This is a very important question because there are, of course, phases in every pandemic. And as a pandemic evolves, the metrics need to evolve with it. I think we all remember in the very early phases, we thought that perhaps we could reach a point where the virus could be eradicated and eliminated. And it's become very clear that that isn't going to happen. And it's going to remain part of the group of respiratory viruses, and will have a smaller or a greater role to play, probably depending on seasonality. So based on that, then it makes sense to look at the things that will stress health systems, for instance, hospitalizations, complications, the need for medical attention, which gives you a good picture of the severity of illness. And then I think the other thing is to look at metrics of transmission, which case counts tell us. But I would say that, all three of those combined is what allows us to make decisions about mitigation measures and what needs to happen when.
Thank you, Dr. Safdar. If you're just joining us, welcome. Our conversation today is with 3 campus experts helping us talk through about what we can expect for the rest of the spring semester. You can find links for captioning and listed in the event description below. And you can also submit questions at go.wisc.edu/S22 questions. We've had more than 30 questions submitted to date, and we will be answering live questions as they come in as well. Again, thank you to our partners at McBurney Disability for captioning today. The next series of questions are about general population health safety. There's a question that came up, the name wasn't submitted, but a question about ventilation in campus buildings. The question is, how can we make sure airflow and air exchange are adequate given what we know about how COVID-19 spreads, especially once masks are only optional? And we do have an update about that on the facilities planning and management page. So that would be facilities.fpnm.wisc.edu. It's linked in the guidance doc. But I would also like Dr. Safdar to comment about ventilation in relation to how COVID-19 spreads.
Yes, so the virus spread, is a combination of many different routes, and that has evolved over time with the new variants. So in the very early stages, this was very much large droplet, close proximity type of spread. And then I think as we saw much more transmissibility happening with Delta and then with Omicron, it became more of a aerosolization into the air and then movement from individual to individual. So I think while ventilation is important and probably always will be for any type of respiratory virus, it is one of many things that we do to prevent the spread of COVID. In my view, at this stage of the pandemic, the single most important intervention, besides vaccination, of course, which is the linchpin of everything, but beyond that, is that people who have respiratory symptoms stay away from other people until they are fully recovered and better. I think this is a bit of a culture shift for us as a society. We can all remember in settings where in meetings people might be coughing or sneezing and the like. And I think that obviously cannot happen going forward, and it hasn't happened for a couple of years at this point. So to me, that's important. I think ventilation, of course, is also, and we will find variations there from building to building and area to area, but that alone cannot do the prevention of transmission that we're looking for. Carol, you might have something more to add. I don't know if I adequately answered the question here.
No, actually, I think you did. I think that it's just, it's important for folks to remember that that's just one metrics. And again, it's going to vary from place to place. And we do have professionals on campus that take a look at our ventilation systems in buildings. And that's one of the things that we know that we will continue to do post-pandemic. And so to to Nasia's point, it's really just one piece of the puzzle with reduction in transmission. The primary piece, though, is really when folks are sick, for them really to stay away from other folks.
Thank you, both of you. The next question will be for Dr. Zumbrunnen. Here's a question submitted by a faculty member. Concerns about teaching after spring break. Dr. Zumbrunnen, can you please share how you've been working with faculty, instructors, and TAs about the classroom space and what teaching will be like after spring break?
Sure. This is another moment in a series of moments of transition and change that we've been working our way through in the instructional space over the last 2 years of the pandemic. And I know from my own experience as an instructor this spring that navigating these moments is challenging, and it requires some flexibility and some grace and a lot of patience with and care for one another. So, our main goal with instructors is to, reaffirm with them that as of tomorrow, there is no longer a requirement to wear a face covering or mask on campus, and that applies in classrooms and all other instructional spaces, as in all spaces around campus. So there's, first just reaffirming that basic new context that the decision of whether or not to wear a mask is now an individual level decision. Within that context, a couple other things we're really emphasizing. One, we've had communications going out to faculty and academic staff instructors, as well as teaching assistants, to let them know that while they can't require masks in the classroom, they can recommend the wearing of masks in their classroom. We've also provided some sample language for instructors to consider using if they would like to ask students to wear the masks in the classroom. I think, again, in that context of recommending or gently asking but not requiring, really encouraging instructors to be mindful of the power dynamics that can be at play in classrooms, and making sure that those recommendations or requests really are recommendations or requests, and don't carry the weight of requiring. The other thing that I think is super important, again, is that all of us, and this is in instructional settings, but really all over campus, that we respect one another's decisions. Certainly some of us are going to be more comfortable continuing to wear masks. For other people, the costs of wearing masks are going to outweigh whatever comfort they would get from wearing them. And I think it's important to recognize and acknowledge that for many of us, the wearing of masks over the last 2 years has been a necessary thing to do, but has carried some costs in terms of, for some of us, the full quality of that face-to-face interaction. So it's going to be really important as we make our way through this transition to both be mindful of the change in policy, and then to treat one another with that care and respect, and just to do everything we can as individuals to make sure that we're having those kind of respectful interactions around decisions we're all going to make about mask wearing.
Thank you, Dr. Zumbrunnen. If I could have you speak a little bit more. This is in relation to a submitted question. The question was, has shared governance perspectives been included in the campus COVID-19 policy decisions, such as the change to the mask policy? So Dr. Zumbrunnen, if you could speak to that, and then Dr. Griggs, if you have anything to add.
Sure. I think throughout the pandemic, and certainly with this latest decision around phasing out the masking requirement, campus leadership, thinking about Chancellor, Provost, Vice Chancellor for Finance and Administration, Vice Chancellor for Student Affairs, the entire leadership team at the campus level. First, I want to just reemphasize that they are frequently consulting and following the guidance of public health experts. That includes folks at UW Health, that includes colleagues in the School of Medicine and Public Health. They're in conversation with, public health experts and leaders in Madison and Dane County. They're in touch with leaders at peer universities as well. And then on campus through our process of shared governance, right? So shared governance involves, university leadership interacting with, informing, communicating with, consulting a variety of different groups. That includes the university committee as the highest level faculty governance committee on campus, but it also includes the academic staff executive committee. It includes a variety of other groups. Campus leaders are in conversation with the deans who lead our schools and colleges. They're in conversation with student groups, including the student COVID advisory group that was mentioned earlier. So yes, those shared governance conversations have been frequent and lively, and are continuing and have continued in the context of this current decision.
Thank you. And Dr. Griggs, is there more that you could add to that?
Not really. Those conversations have really been happening broadly, to John's point. And so it's definitely one of those things where we've been engaging in the discussions to really hear what the public health professionals recommend, So much so that we even, we knew that updates were going to come from the CDC. We also work closely with Public Health Madison-Dane County, and their mask mandate went off on March the 1st. And so, even with the timing of ours, it's still all within that landscape of public health best practice. And so those conversations they've been taking place. And I think that we're in a pretty good place now with our policies aligning with a lot of what we see from the CDC on down to PHMDC.
Thank you. This actually, you mentioned the CDC, and this leads us to one of the submitted questions that I'm hoping Dr. Safdar can walk us through a little bit, which was explaining the updates that the CDC made on February 25th to the mask guidelines. So there were a couple of questions that came in, and we're consolidating that into, if you can please help us walk through or talk through the changes that the CDC made on February 25th.
Yeah, so, just to set the stage for this. So, of course, the CDC still recommends masking. I think the big distinction is how strongly one recommends it or what the requirement is likely to be. So with the current state of this phase in the pandemic and the relatively low transmission that is being seen in many states around the country, if you're in a place where the risk of transmission is low, you don't have to wear a mask in indoor spaces or, for that matter, outdoor spaces. Now, this doesn't mean that if somebody would be more comfortable wearing a mask that they shouldn't wear it. They absolutely should. But it comes down to the individual risk assessment level. And for many of us, it's really this trade-off between, how comfortable do I feel in this setting with or without a mask, and having one at the ready if you feel that you would be more comfortable wearing it. I think these recommendations are a natural consequence of what we're seeing in front of us. We would not have seen this update if the virus had been raging the way that it did when we were seeing Omicron in such massive numbers. And to be candid, we don't know what the fall and what the future holds for us. So it may be that we would have to reinstate some of those things. But now is the right time for some reprieve, I think, which we, I think, is a good thing to do at this point.
Thank you. And the next question will be for Dr. Zumbrunnen. This is another question submitted from the Student COVID Advisory Board, that group of 8 students appointed from shared governance that's been meeting since 2020. The students here would like to hear some of the actual language that faculty was given about how to handle masks in the classroom. Dr. Zumbrunnen, can you speak to, again, some of the language that was given, whether it was, guidance, written, spoken, otherwise?
Sure, I absolutely can. We've sent a couple different messages out. We've sent messages both to all instructors, but then also messages to department chairs, recognizing that, sometimes my colleagues are more likely to read an email from their department chair who they know than from the Vice Provost for Teaching and Learning. Those messages specifically use the language of recommending but not requiring the wearing of masks in classrooms. And then they give some sample language that an instructor might consider about respectfully asking students to wear masks in the classroom, as it would make the instructor feel more comfortable. To be honest, I don't have that specific template language in front of me. And if I did, I'd be a little wary to read it, because we really didn't intend that sample language to be a script that every instructor would read. I think the way that this is going to play out, again, in that context of the basic can't require, but can recommend or gently and kindly ask, within that broad policy context, we're going to see instructors and students having these conversations. And, look, we know that for some instructors and some students, they're going to have some concerns and anxieties, understandably, about, after a long time with everybody being in masks in the classroom, now being potentially in the presence of folks without masks. And so totally respect and understand that anxiety. And yet really need to navigate those conversations about masks with great care and mutual respect. And as I said earlier, what we're really trying to communicate to faculty is that they can recommend or ask, but making sure they do that in a way that's open, compassionate, signals to students that we respect their individual choices.
Thank you. Thanks for sharing that. The next question is submitted, and I just want to remind folks that you can still submit questions. There's a link below to submit questions at go.wisc.edu/S22 questions. More than 30 questions were submitted, and we are still accepting live questions. So this next question was submitted by someone named Karen on campus, and I'm hoping Dr. Safdar and Dr. Griggs can each take turns answering this from your perspective. The question reads, I'm curious about why the mask mandate could not have been extended to the end of March to cover everyone's return from spring break. Can you explain more of the rationale behind the timing of the mandate ending?
Carol, you want to start, and I can add to it if you want.
Sure, absolutely. So again, I think it goes back to how those decisions are made in the sense of the updates that we have from the CDC and the updates that we have from Public Health Madison-Dane County. We have throughout the pandemic made it a point to really focus our emphasis on making those recommendations as far as decisions go based on the data, based on what's in front of us, and based on what phase we're in. And the variables that we have right now are dramatically different than what we had in 2020. And so even when we look at the mask mandate, when we look at the science itself, the question is there of extending beyond the time frame that we have, if that actually is something that is something that's supported by the science itself. And so when we look at what PHMDC is doing, we look at what we're doing as a UW system, extending beyond March the 12th would have likely been something that would have made us step outside of the lane of basing those decisions on the science that was in front of us. Nasia, I don't know if you want to add anything.
Yeah, this is one of those things that we all wrestle with from time to time. What is the right time to make these decisions? And the truth is that there probably is no perfect time. I think now that we have to learn to live with and to coexist with this virus, we want to have every decision, and it necessarily has to be that way, that it has to be a little bit of a trade-off. And the time is now right to make this decision about not requiring masks. If we were in a different space, if there was still a surge, if there were a lot of hospitalizations, I don't think we would even be having this conversation, of course. And like I said, it may well be that things would evolve in the future, but it is a good idea to make decisions based on what's in front of us. And the case counts and the disease burden all reflect the fact that this is a good decision at this point.
Thank you, Dr. Safdar. We just had a question submitted live. Again, we are accepting live questions. And this one reads that there have been multiple reports saying that non-N95 masks are ineffective. Dr. Safdar, can you please speak to the effectiveness of a non-N95 mask?
Certainly. So, the principles of masks are there regardless of what the specific type of mask is. And so the main things are that it has to be multi-layered, that it has to be close-fitting, that it has to cover the nose and mouth, and that it should be breathable to the point that you're not continually having to adjust it. One of the concerns with masks throughout all this time has always been that a mask only works when it's properly put on and kept on. And because many of these things aren't necessarily comfortable for everyone, we see people where it's below their nose or they're having to pull it apart when they are trying to speak or project and so on. So when you take all those principles into account, then a well-fitting mask is adequate for protection against the SARS-CoV-2 virus. Now, nothing is 100%. So are there breakthrough infections that can still happen even when people mask? I think the answer to that is an obvious yes, because we've seen that around the world. In terms of, if you're able to tolerate and wear a KN95 or an N95, which just by its nature is very closely molding to the nose and mouth, that will also work just as well. But it doesn't only have to be that mask. There are many others which, if they follow the same principles, will also be fine.
Thanks for answering that one. And here's another question submitted by the COVID Student Advisory Board, but let me paraphrase it a little bit. There's concern that students will forget to carry their masks after spring break. And for example, they're still going to be needed on buses, or there might be instances where someone might ask for someone to wear a mask because of their health condition or preference. Dr. Safdar and Dr. Griggs, do you have recommendations about how to talk to peers about continuing to carry a mask, or ways that you would recommend someone could ask someone to wear a mask if that felt more comfortable for them?
Yeah, I can get us started on this one. So one of the things to remember is that here on campus, we will continue to make masks available. And so we will have masks available at our antigen distribution sites. There are also some offices that have masks available. Those would be the 3-ply surgical mask. And so we still plan to have those available on campus so that if someone does forget a mask, we have them readily available. When you think about talking to people about remembering to wear a mask, I think honestly the best and healthiest way to do that is to simply just, remind folks in a gentle way, not forceful, not, telling them that they have to, but just reminding folks, don't forget, that masks are still required in public transit or public transport. And then also just that it's a good idea to have a mask on your person. You never know when you might enter a situation in which you yourself might start to feel a little uncomfortable. And so having a mask in your backpack, in your purse, or whatever, type of satchel you might be carrying is going to be a good idea. And I would actually say that that's true even outside of the COVID environment. Prior to the pandemic, masks have always been a part of the public health landscape. It's just a matter of if they were something that were normalized here in the United States of America, and they really weren't. We saw them in other nations, but here in America, we had not really gotten to that point. Now, the pandemic has pushed us to that point where masks are somewhat normalized in our environment. And so people should feel really comfortable with just having a mask, 2, 3, in their bag, so that anytime they feel uncomfortable, anytime they're around someone that they, someone that might be sick, they might suspect to be sick, they can always put a mask on. And so it's always going to be a good idea.
Yeah, I completely agree. I mean, I would think of it as akin to, just as you carry your keys, you carry a supply of masks with you. It's besides the fact that, of course, you don't know when you might yourself want it. We're all going to be just in part of daily living, encountering situations where there might be someone else in front of you in the queue or something who's coughing or sneezing. And the simplest thing to do would be to just put on your mask at that point. As far as, asking people, my usual strategy is to say, I'd feel more comfortable if we wore masks. And then I put it on, and then I leave it to the other person to decide what they would like to do. Of course, people will have their own opinions on it, but in my experience, conversations with peers have generally been very respectful, and people will do whatever makes others feel more comfortable. But
thank you. Thanks, both of you. And as a reminder, this was mentioned, but we continue to offer masks, including N95s, on campus. You can find out more information about where to get these at covidresponse.wisc.edu. And again, a reminder that we also have no-cost antigen tests available at the Memorial Unions, so 2 locations where you're able to pick those tests up. Next, we're going to switch into some vaccine guidance. So again, a series of questions that were submitted to us. We had about 30 questions submitted before this, and we are accepting live questions. We've had a couple of live questions submitted so far, and you can submit those at go.wisc.edu/S22 questions. So this next question I'm going to read is from an undergraduate student, and this one can go to Dr. Safdar. And it reads, I'm an undergraduate and I'm fully vaccinated and in good health. I also just had Omicron. When I become eligible for a booster, do I need to get one right away or can I wait?
So I think one of the things that we've seen with Omicron is that there is a risk of reinfection that was higher than with the other variants. So my recommendation is that even people who have had it and have had the full dose of vaccination series also get the booster. Now, as to the timing of the booster, I don't think that there's, any harm in waiting a little bit, for instance, but in my experience, when people wait, they tend to keep on waiting. So I typically tell people, when you've recovered from it, you just go and get the booster just to get it out of the way.
Great, thank you. And here's a follow-up question. This one can be for Dr. Zumbrunnen. You said something about instructors talking with students and about students talking with advisors about masks and just comfort level. Could you please give a little bit of follow-up on that?
Sure. I think, I'm teaching this semester. And so to be honest, it's not just me writing language into emails. It's me thinking through how I'm going to have these conversations with my students. And so those conversations between instructors and students tend to be front of mind for me. But we're going to have a lot of these conversations, students and advisors talking with one another about mask wearing and students talking with one another. And just to build on what was said a few minutes ago, the way I think about these conversations going are sort of, hey, I'm wearing a mask. I'm more comfortable wearing a mask for my personal protection. I think the person speaking may want to add specific reasons why they're wearing a mask if that's something they're comfortable doing, and then pivoting from the I'm more comfortable wearing masks, I'm hoping you might be comfortable putting a mask on too. And I think it's those kinds of conversations. And I said earlier, even though we've given some sort of sample language to instructors, I don't think there's one precise way that script or that conversation has to go. I think it's a matter of two human beings interacting with one another and being honest about our comfort level and our choices, and politely and respectfully asking the other person if they'd be willing to act accordingly. I think, as I say, I think we've got a lot of focus on the instructor-student. Those conversations are going to be playing out in a lot of places, and ultimately they all need to be guided by that fundamental principle of mutual respect of individual choices.
Thanks, Dr. Zumbrunnen. I will say that, we had a team meeting this morning where we had pretty much this conversation amongst a group of us where we talked about our comfort levels. We offered grace to each other. We also said, not to make assumptions based upon if someone's choosing to wear a mask, to feel comfortable, to ask someone to wear a mask as well. So we've all had practice, doing this, and we continue to practice with this. And again, approaching people as colleagues and with trust. And I think it went very well.
And if I could just jump back in quickly, one thing I'm mindful here too of is, again, respecting those decisions not to wear masks. One thing that we've actually emphasized to instructors throughout the pandemic is that there are some people in our campus community who are unable to wear masks for particular health reasons, right? And so I just was thinking, Marlena, of what you said about not making assumptions, right? So that when we see someone who's decided not to wear a mask, trying to check ourselves on creating a story about that person's decision, and again, respecting their decision. And if we choose to engage and have a conversation with them about our choices, again, respecting what they tell us. So
yeah, we're all having different types of conversations than we were a couple of years ago. So as we continue, I want to remind folks that this is being recorded and will be available on our website afterwards. We are still accepting live questions, as well as we are working our way through a number of submitted questions. But again, we're going through some live questions, and we actually just had one come through. This is a question from someone named Susan. Susan asks, how long does protection last for COVID-19 boosters? Dr. Safdar, could you please help us with this one?
Sure. I'll just start out with a caveat that, our understanding of the protection from vaccines is a little bit incomplete, because we are only typically measuring the one arm of the immune system, which is the antibody response. And so we know for antibody response, when measured in the blood, for several months after the booster, it stays up. And then over time, there's a gradual decay, probably in the order of 6 months or thereabouts. But there's a whole other arm of the immune system, which is the T-cell mediated immunity. And that likely keeps protecting us for long after the antibody measurable response is gone. Now, that piece is a little bit hard to measure, but I think it is for all those reasons that I'm a little bit more optimistic about how long boosters work than if you solely look at, the levels of antibodies in the blood.
Thank you. And this is another one adjacent to a booster question. And Dr. Griggs, I'm hoping you can answer this one. Will boosters be required for campus to be considered fully vaccinated or up to date?
Yeah, so that's a great question. I think that the best way to think about it is really that we are shifting our understanding of what it means to have the highest level of protection, which that in and of itself means that you are up to date on vaccines. On campus, we've come to think about or know the idea of being fully vaccinated because that's actually linked to other actions on campus. And so that's linked to testing right now. But once that isn't in place in the exact same way, really the question is, are we still going to use language about being fully vaccinated or not? From an epidemiological standpoint, we probably shouldn't really use the fully vaccinated language in that specific way anymore, because it really is about are you up to date, or have you received the most recent dose that was recommended so that you have the highest level of protection?
Thank you. And you mentioned testing. So here's a question from someone named Tom that was submitted. And Dr. Griggs, I think you can speak to this one. I'm going to read the question from Tom. As of late August 2021, campus had in place a weekly PCR testing requirement for students and staff who've not provided proof of COVID-19 vaccination. What criteria needs to be met and what outcomes will be seen, and under what circumstances will officials decide to end this testing policy on campus?
Yeah, I think that is a multi-layered question. Some of the metrics that you look at when you have that type of protocol in place, again, it really is stemming from the recommendations that come from the CDC. And those type of policies, really what they're designed for are to look for asymptomatic cases in the population that asymptomatic cases would be more prevalent in. And the idea behind that is that if you could slow the transmission that happens with asymptomatic cases, then you might potentially be able to slow how the disease actually works itself out within your population. When people manifest symptoms, that's a sign, it's a trigger. It tells them I'm sick. It tells them that I need to stay away from others. But when people are asymptomatic, you can't measure that in the exact same way. And so you have basically unchecked transmission. And so earlier in the pandemic, the CDC, as well as other organizations like the American College Health Association, had recommendations out there to really do surveillance testing on your population, specifically the unvaccinated population. And that was the protocol that we implemented. So now that those variables are starting to change, I'm sure that that's going to be something that is constantly considered and looked at. At this point in time, though, the testing requirement on campus for students has been extended until April the 3rd, I believe, and then the employee requirement is still currently in the workplace policies. And so I'm sure it won't be there forever, but that's currently where we are with regards to the testing requirement.
Thank you. This next question for Dr. Safdar, this was just submitted from someone named John. Can you explain the difference in how the CDC defines low community rate as opposed to how Dane County defines it? The CDC states that Dane County has a low rate, but until today, the Dane County dashboard still listed Dane County as having a high level.
Yeah, so this is just as part of the, the evolution of metrics in response to the evolution of the pandemic. So the CDC has adopted, in addition to the case count, these additional metrics on hospitalizations and new admissions to the health system for COVID, and things that would allow us to get an estimate of how bad things are when it comes to resource allocation for medical attention and healthcare needs. So when you take all those into account, then the rate is low because at the moment hospitalizations have really plummeted. The need for medical care has plummeted. So all indications are that things are going in the right direction. But on the other hand, we know that, there are breakthrough infections happening, especially with Omicron being the predominant variant. So the case count, if that was the sole thing you looked at, yes, you're still going to see transmission. Admittedly, less so here than in many other parts of the country because of our high vaccination rate, but breakthrough infections are very common with Omicron. And I suspect that's part of the difference that Dane County hasn't completely updated to reflect the new CDC metrics. And of course, every community can choose to do what is the right thing for them to do. But overall, if we look at the big picture, things are a lot better in terms of where health systems are at and where the communities are at with what the pandemic is looking like compared to even like 2 months ago.
Thank you. A question just came in about classroom expectations and protocols. Dr. Zumbrunnen, I'm going to extend this question to you. And then maybe this can be for all of the people on today. If a student tests positive after having attended class without a mask, what is the protocol that should be followed by other students and the instructor? Is there any difference between a large lecture, a 50-minute class, and a 3-hour lab? And I think I'm going to turn to all three doctors present on this to answer that one. Go ahead.
Yeah, I can start off and say that I'm gonna answer this as an instructor and as I think instructors should answer this, which is turning to public health guidance from our public health experts. And that's my fellow panelists.
So I guess I would say, just like in any other setting, as we start to go more out and about our daily lives, this scenario is, of course, has already come up for many people and is likely going to come up for many more. And so the main thing to do is to follow your symptoms and to get tested. And now that there is ready availability of those tests, I think it would be a good idea to test yourself because, of course, you could be asymptomatic and still have it be transmitted to you. In terms of whether there's a campus protocol or not, I'll defer to Dr. Griggs for that.
Yeah, sure. And what I can say from a campus perspective is that it's really important to remember that we still have some safeguards in place to kind of help specifically for situations like this. We still have a contact tracing team. We'll still collect information on when a person tested positive, where they were located, what classes they went to. We have the ability to see who potentially was in that class and all those type of things. And so we still have all those in place. I will say, as time goes on, those things will start to fade as well. And the reason those things will start to fade is just because when you think about the pandemic in and of itself and the metrics that we're using, all of that is shifting. Here recently, the CDC even released their own update about contact tracing, indicating that global contact tracing doesn't hold the exact same place as it did previously. And really, we should focus those resources on looking at high-risk situations. And so right now, we continue to have a contact tracing team that's managing these types of situations. But post-spring, we don't know what that's going to look like. And I think that's really going to be driven by a couple of factors. One, are we still in a public health emergency? There are a lot of talks about where we're going to be when we get to the end of the semester. And then the other factor too is what are the local Public Health Madison-Dane County and DHS, what are some of the local public health entities recommending and doing? Because again, everything that we do here on campus, we really do try to follow the guidance and the guidelines of the organizations or the structure that we follow within.
Thank you. Here's another question that was just submitted from someone named Jose. What type of accommodations may be expected to be offered to immunocompromised students in the classroom? Dr. Zumbrunnen, can you talk about how you've been working with instructional staff about supporting and accommodating immunocompromised students?
Sure. And so, for immunocompromised students, students with other concerns about being in the classroom after the phasing out of the masking requirement, the best course here is for those students to be working with the McBurney Center to explore their accommodation needs, and then the McBurney Center will work with students and with those students' instructors to work through reasonable accommodations. That process, was in place and going on before COVID, has been active, of course, right through the pandemic and up until today. So, that's really what we want to encourage students to do, is to work with McBurney as soon as possible. And then, we work with instructors to make sure that we're all fulfilling that responsibility we have to offer reasonable accommodations. Outside of that formal accommodations process, and really kind of linking back to the last question, really encourage instructors to listen to students' concerns, to be respectful of the privacy of students' health information, and to respect and accept when students tell us that they've tested positive or they're staying at home because they're feeling symptomatic. They're doing exactly what we're asking them to do as a university in those contexts, and to be supportive and flexible with students. And, that flexibility will look different in different kinds of classes. And, we've got support in place to help instructors provide different modes of access to course materials and activities as necessary when they're providing that flexibility for students. And again, on this front, really keep coming back to that need for instructors and students and everybody else to be in frequent and open communication with one another, and to work through the challenges that arise together.
Thank you. And since you started answering that question, we had a number of community members submit some live questions about those concerns around those who are immunocompromised, including babies and young children. So obviously many members of our community have family members who don't have the option or availability of being vaccinated quite yet. Could you panelists share your best advice for people who have those concerns, those who aren't yet able to be vaccinated? Dr. Safdar, if you could start us off, please. Dr. Safdar, you're muted, so we're going to have you start over. Oh, there we go.
There is a distinction that we make in the field about whether somebody is not able to get the vaccine because they're below the recommended age group versus somebody who's immunocompromised may still have taken the vaccine, but it is not expected that it will work quite as well in somebody who's not immunocompromised. So when you take babies and children, and of course, I'll just start out by saying that there are exceptions, and there have been several thousands of cases of COVID in children and babies in the US. But as a group, as a population, that group has fared much better than people who are immunocompromised and are older on the other age of the age spectrum in terms of their recovery. The vast majority of cases of COVID in babies and young children have been very mild symptoms or have been asymptomatic. Now, it doesn't mean that that's a good thing to have. And of course, whatever one can do to prevent it is always ideal. But I think we are now trying to be in a place where we realize the virus is all around us and we are at risk of acquiring it, just as we are at risk of acquiring other types of infectious conditions as part of daily living. So I don't think we can say that you can completely and entirely prevent any cases of COVID-19 in people who are vulnerable, which includes young children. But I think that some of the mitigation measures that have been placed, meaning that if others around them are vaccinated, that protects them, for instance, as one key aspect of it, that helps. We don't know what the vaccine situation will look like for this particular age group because the data has to be pretty strong. I mean, it has to be an effective, long-lasting vaccine, and I don't think we know quite all the details about this particular group at this point.
Thank you. Would anyone else like to offer any advice or suggestions?
No, I think Nasia answered the question beautifully.
Great. Again, just a reminder that you will be able to find this on the COVID response website. We are recording this, and then a lot of information, including some frequently asked questions, is available at covidresponse.wisc.edu. Dr. Safdar, another question for you that came in, where someone would like to hear you comment on the risks of long COVID. For example, how it might relate to cardiovascular conditions and the importance of our community to help prevent long COVID and potential associated disability with that. If you could please comment on that, please.
Sure. So long COVID is a syndrome that we are still learning a great deal about, but it does appear to be, has a lot of protein manifestations, meaning that, it's not just a respiratory syndrome, for instance, as the person asking the question alluded to, that it can really have symptoms manifested in the central nervous system and the lungs and the heart and so on. So while we don't know everything about long COVID, I think there are a couple of things we do know, which is that it is likely an aberrant immune response of the human body against interacting with the virus. And so it's not likely that the virus is live and contagious and so on, but the individual is getting these symptoms from their own body's response. And there are a lot of potential therapeutics that are currently being studied for preventing and treating it. The biggest thing I think that is encouraging that we have seen is that vaccination will protect people from long COVID, even if they get breakthrough infection despite being vaccinated. And so I think that's really encouraging. Beyond that, I think people have pointed to changes in the gut microbiota potentially as being related. And there's a lot of, I think, lines of inquiry, but I don't think we have a lot of the answers we are seeking for long COVID at this point.
Thank you. We have a question submitted about some of the overall strategy in the change of testing on campus. Dr. Griggs, you spoke to this a little bit, but could you please speak a little bit more to how we came to the process and the change of the strategy for testing on campus and compliance?
Yeah, absolutely. So when we look at testing in and of itself, testing is a good metrics or a good tool to use to identify anyone that might have SARS-CoV-2 particles in their body when they actually take the test. So we started a process in which we required folks that were unvaccinated, which in the fall of 2021, we had fewer people. Well, we had a lot of people vaccinated at that point, but we didn't have as many people as we ended up with, which was close to 95, 96% of our population that were fully vaccinated. And the goal in that, again, was really so that we could identify those asymptomatic cases. When you have folks that have symptomatic cases, the virus is manifesting itself with symptoms. So it's self-identifying. And that's a trigger for someone to, one, go get a test, and two, to stay away from other people. And even if the symptoms aren't SARS-CoV-2, they could be symptoms related to something. So it's still a good idea to stay away from other people. But that does serve as a sign, and it tells people that there's something wrong and I should keep my distance from others. What we noticed is that A lot of the asymptomatic cases, and this is really something that we've gleaned from the CDC and PHMDC and DHS, a lot of the asymptomatic cases were still in people that were unvaccinated. And so that was the population that we primarily focused on with the testing requirement, if you will. And so now as we progress along, we still will have testing available on campus. We actually have a very small population of people that are unvaccinated that are still required to test on a weekly basis, but that tool is still there. The variables that we're working with now are different. Previously, we didn't have as much antigen testing, whereas now we do have a robust amount of antigen testing available. We have antigen testing available on campus. All you need is your WIS card, and you can pick up a test this week, I believe ending tomorrow. If you go to pick up an antigen test, you can actually pick up 2 antigen tests to kind of get you through the spring break period if you need them for that. But you can also order tests from the government, and you can also order them via your insurance. And so antigen testing is available in a large, in many ways, in a large amount at this point in time. We've actually seen our PCR testing this week go down. And so we actually haven't had as many appointments this week, and we anticipate that we'll continue to see those declines. Next week, we will have PCR testing available, but we will not be distributing antigen testing next week. And then coming back from spring break, of course, we'll have both available again. And so at this point in time, we still have testing available for anyone that wants to test. We are seeing a decline in the PCR utilization. But again, it's a good metrics to use just to make sure that you don't have those viral particles. If you're really looking at transmissibility, or if you have like enough virus to actually render the ability for you to pass it on to someone else, antigen tests work really good for that. And so we will continue to have those for the duration of the semester.
Thank you. We're getting close to the end of our time together, and I want to answer this question from an individual named Tim. I think this is more of like a thought response that I'd like to get feedback from all of you. And let me paraphrase a little bit, where Tim is saying that it feels like the ending to both our protocols on campus and in the community feels very jarring, almost like the initial impact at the beginning of the pandemic, where everything felt like it was all at once. So this individual is saying it feels like we're ending things quickly, just like things started very quickly. And he's looking for some thoughts about how to process this. So any tips would be appreciated about how to get through what feels like a very jarring time in our community, and across both at UW-Madison and then within the larger Dane County community. How do the 3 of you talk to people about these changes?
I mean, I can get us started on this one. So for me personally, one of the things I really like to focus in on when talking to folks is just really encourage that mindset shift that has to happen. And I know that that's difficult. It's definitely not an easy thing to do. But in 2020, when the pandemic started, there was fear, there was anxiety, there were a lot of feelings, and we pulled out all these public health tools that became safety blankets. They became tools that would help to reduce transmission, and that was the primary goal. And as we've gone through the phases of the pandemic, similar to what Nasia talked about earlier, those variables or those different tools that we have kind of shifted. They've still been there, but the need for them at the same level has shifted. What didn't shift often was our mindset, how we think about these things and how we feel about these things. And I think for those that feel like it's jarring right now, part of it is that we never took that step back to really evaluate and assess where we are in the pandemic and how we feel about where we are in the pandemic, and then the reality of where we are in the pandemic with regards to transmission and hospitalizations and all these things. And so for folks that are engaging in conversations and thinking about it right now, I think it's a good practice to take that step back, to look at where we are. We've come through this. It's been 2 years. At this point, folks really do have a combination of elements of protection and immunity. We have people that are vaccinated and boosted, people that are vaccinated, boosted, prior infections, people that have multiple prior infections. And so when we think about our population, we really do have a higher level of immunity. And so that does mean that the need for mandates and requirements is starting to fade some. Doesn't mean that you have to just throw those masks away, but it does mean that we're in a different place, and we have to start thinking about how we personally approach these situations. SARS-CoV-2 is going to be here. It's not going to go away. And so just thinking about how we personally feel about that and how we can function in the environment would be really helpful.
Thank you.
I don't think I have anything to add to that great response. Simply just acknowledging that, yes, it is jarring and we haven't had the time to process it can be so helpful.
You know, the thing I was actually thinking as Carol was talking is how thankful I am to have folks like Carol around, and it's really comforting to have experts who can help us make our way through this. You know, the reality is I completely know and have experienced some of that sense of jarring change. If I'm totally honest, exactly, where I'm at on masks and how I think about my personal choices is not a constant. It changes and flows depending on the context I'm in, and sometimes a little bit day to day. And, again, for me, being able to sit with some of that sense of change and discomfort is certainly just an enduring challenge of where we find ourselves right now. And I think, I think nothing that we have to say about policy and guidance can or should really take away from that very real human experience. And just to cycle back to a word I've used a lot here today, mutual respect. So, taking care of ourselves, respecting the fact that different folks around us are going to be in different places than we are at times, and trying to move forward with being part of a community of care here on campus and out in the world is I think what we can all try to strive for, and recognizing that that's a challenge at times, and giving some grace to ourselves when we're having one of those moments that we all still are going to be having, and then extending that grace to others. And I know that people like me have been saying that a lot over the last 2 years. And when I'm on the listening end of that, sometimes I get tired of hearing it, but I'm not sure that we can say enough that importance of grace to yourself and grace to others.
Thank you. Thanks to all three of you. This has gone by incredibly quickly and has been very helpful. Thank you so much for taking time to talk to us today. I'm thankful that we've been able to be in conversation around this. I feel like we could talk for another couple of hours. We did our best to get through as many questions as possible. And I hope people feel like they were heard and listened, and we were able to extend that grace to them as well. I just want to remind folks that this link will remain active on this YouTube page and posted on the COVID-19 response website. Please continue to monitor that COVID-19 response website for the latest information and FAQs. There are hundreds of FAQs on that page, and there are a number of people who spend a lot of time making sure that those are up to date with most relevant information. Continue to watch your inbox for updates from the Chancellor and your HR representative. Continue to post questions. We're here. We're often the people behind those emails answering those questions. And again, we want to be that trusted source for you to make you feel healthy, safe, and well on campus. So thank you again to Dr. Griggs, Safdar, and Zumbrunnen. Thank you everyone for tuning in today. Best of luck and be well. Thanks everyone.